All right, let's go ahead and get started. And if anyone else hops into the waiting room, I'll let them in. But uh, thank you all again for being here. My name is Mariah Blevens. I'm CFHI's Programs and Student Engagement Coordinator. So today we put together this little convening space for individuals who are considering doing a CFHI program this summer, or I know many of you are already enrolled. So we're happy to have you here just to welcome you. We're going to talk a little bit about the experience, what to expect next, and we're joined by several of our amazing alumni as well, so they're going to also just share some of their tips and tricks for having a great experience, and of course, be here as well to answer your questions. So, just to get started, I've never really done the icebreaker activity we're going to do, so we're going to try it out. But if you could all start by just maybe typing in the chat where you're from, so city, state, or country if you're not from the US, maybe your university, tell us what program you're considering or going to, and then the month of your CFHI program. So let's put that all in the chat if you guys have a second. And alumni, if you want to as well, you can also participate and put what program you went to. All right, we have Amanda here from Florida going to Bolivia. Awesome. Aditi from Minnesota going to India. Mia from Kentucky, also from University of South Florida going to La Paz. Thanks, Casey. All right, thanks everyone. Yeah, keep them coming. The next kind of activity I'm going to do is throw together a word cloud. This is going to be like a compilation of, I'm going to put where everyone is from, where they're going, and then one more thing that you all could share, which would be amazing, is one word that excites you or encompasses what excites you most about your global health journey. So something maybe related to clinical shadowing, the cultural experience, traveling abroad in general, or anything like that. So yeah, feel free to throw that just one word into the chat. And I am going to start putting together a word cloud. Any words that come to mind? What excites you about yours? Adventure, that's a good one. I love that. Growth, interaction, these are great. Culture, yeah, that's a great one. Give it one more minute, and if anything else continues to come to mind, please feel free to put it in the chat, and then we'll move forward. It's great to see we have so many people going to different countries. All right, let's see. Learning, yeah, that's a great. All right, last call. Anyone else want to share a word that comes to mind when you think about what's exciting you about your CFHI journey? All right. All right, awesome. Thank you all so much for participating. I'm going to share, at the end of the call, I'm going to share the results of the word cloud. But for now, let's move forward. So again, thank you all for being here. As you can see, the individuals on this call are really representing a lot of different places and backgrounds, and many of you are going to different CFHI locations. We currently have locations in 10 different countries, and it looks like we have a pretty good variety of individuals on this call, representing, where you're going and the possibilities and things like that. Really quickly, before we dive into talking about the experience and hearing from the alumni, I just love to give a really super brief overview of CFHI. I know that, a lot of you who are already on this call are already enrolled, so this is not new news to you. But I'm happy to share just a little bit of overview, especially for those who are new to CFHI and this is like your first time in one of our spaces, just to kind of ground your understanding of who we are as an organization. So CFHI is a nonprofit organization, and we've offered immersive global health education experiences for over 30 years now. The alumni here on this call are part of a big group of 17,000 alumni who have traveled abroad before in our programs. And if you're considering going this summer, if you're enrolled, you're going to be joining that cohort as well. Just a few things that make CFHI unique. You might have heard of other, global health education entities, or there might be some other opportunities you have explored or been exploring at your school. But I like to share just a little bit more about CFHI because I do feel like our approach is a little bit unique, especially in the field of global health education. So there's a few things here. We're in special consultative status with the Economic and Social Council of the United Nations, and we have also received a lot of awards just in our work as a nonprofit and our work around like transparency, equity, and inclusion, and mainly our ethical engagement and approach to global health. So that's really one of the main things I like to highlight is just uh, CFHI programs are very intentionally structured and tailored to take into account these ethical considerations. In the past and even still today, there are some, forms or methods where people have approached global health that might not be sustainable or can bring harm to local communities. So CFHI has worked really hard over the last 30 years to curate the experience that really challenges those traditional colonial narratives and really helps learners understand that they're going abroad as a learner, immersing themselves in the culture, and that there's just so much to learn from the world around us and where you're going and visiting. So, within our approach, it's not a mission trip, it's not volunteerism. We're not sending students abroad to, go have unsustainable pop-up clinics, or, we're not sending students abroad to go practice medicine or like handling sharp objects on individuals in a low to middle income country when you might not have the experience or training to do that abroad. Um, and we're never, putting you in a position where you could potentially harm yourself or harm individuals in the community that you're visiting. Instead, the program is really, again, more of a learning experience. So we're intentionally emphasizing the existing resources and systems that are present within the community you're visiting. And the approach really tries to focus on a more asset-based engagement rather than like a deficit approach or lens, which that really helps you see global health through a real world context and perspective, rather than seeing like Band-Aid or short-term solutions. Um, that all being said, you're joining a team of local practitioners when you go abroad, so you're really getting to learn from them as the experts of their own environment through your rotations and health activities. And then also, if you already know this, if you're enrolled and starting to work through the steps, but we try to do our best to prepare you well in terms of like cross-cultural training and preparation prior to the time that you go. So these are all things that are like encompassed into the experience, and I feel like it's helpful as you're preparing for this, just so you understand there's so much going on that's really allowing us to help you have a positive time abroad. So that all being said, I love to just draw attention really quickly to our tagline, which is "Let the world change you." I think it's really great for like setting the tone or the narrative for how you're thinking about your objectives for your time abroad. Obviously you're not going abroad to fix or to save save things or save people or anything like that, especially, you're having most of you are having a short-term experience. So I think let the world change you. I mean, it might mean something different to everyone, but what we try to encapsulate is that it really is more about listening and learning and not necessarily fixing. And it's really an invitation for you as a participant to, approach this experience with humility, with openness, with a willingness to reflect and to learn, and, really to take on that transformative perspective and narrative and helping you understand health in general as well as culture through those more contextual, cultural, and community lenses. So that's what it means in general, but like I said, there's a lot that goes into that. I like to just share this really quick alumni video as well. This was a video from 2024, but it pieces together some snippets from alumni interviews about what the tagline meant to them after their program experience. So I'm just going to play, it's about a minute and a half, and then we'll move on, talk about the experience, and then hear from our alumni. What does CFHI slogan, "Let the world change you," mean to you?
That slogan it really is just what it says. It's that we are, a small little speck of stardust on this planet. And while we can influence it to a certain extent, it really is about, especially in education and higher education, it's all about just letting new experiences and new people and new cultures into your life and your heart, and understanding that, I think I came away more changed from this experience than anyone that I met there was changed by me.
As a physician, my goal is to improve health, limit suffering, and that's a goal that doesn't have borders. And so CFHI has been great because it gives you an opportunity to see and gain exposure without in a safe environment, so that you're not causing damage to a community, but rather benefiting and learning.
By going there and just learning, observing, taking it all in, you truly are changed. Really was an experience 100%. Obviously, I will never forget, and is helping to guide me in my future career path, and even in, just helping me grow as a person. So it's 100% accurate, and you really will. There's no way you can't be changed.
All right. Okay, let me move on. No, don't replay.
What does CFHI slogan,
second.
"Let the world change you," mean to you?
That slogan,
I don't know why I cannot move on. Okay, let me go back. No. Sorry, guys. Okay. All right, so what is the CFHI experience? We've talked a little bit about what it's not, and I gave the more constructual concepts that we tried to emphasize and highlight in the experience. But I like to also just share it here in some bullet points, just so you understand like what it is that you are taking away from the experience. So, of course, you're not going abroad necessarily to be a doer, but you're going to learn from it by showing up as a learner, by listening and observing. You're going to have the amazing opportunity to shadow in different clinical settings, depending on where you're going, or, partake on different public health activities, learn about what NGOs are doing in the local community. And along the way, you're really getting exposed to another healthcare system, which is going to be really different than what you see here in the US if you're US based. And you're also going to have a better understanding of, the community you're going to, and maybe how their health system or health is shaped by different aspects of culture, history, policy, cultural determinants of health, access, and things like that. The experience is really going to challenge your assumptions and push you to think differently, sometimes leaving you with more questions than answers, which is, obviously where meaningful learning happens. You're also going to really have the chance to make meaningful connections, build relationships with either your host family or conversations with individuals in the community or the people that you're shadowing on a day-to-day basis. And through, that very intentional learning and reflective approach, you're just going to gain a deeper sense of purpose in the world, maybe your career path, curiosity, and awareness as, your role as a global citizen. And then, of course, you're going to be building all types of different important skills like communication skills, working with people from different backgrounds, um, more tangible skills like time management, resourcefulness, and things like that. So there's so much that goes into this, and I like to highlight that. But I think more importantly, we do have several alumni here on this call. So I'd love to dedicate some of this time to hear directly from them. And then we'll also have lots of time towards the end of the call for you guys in the audience to ask questions. Also, feel free to throw any questions you might have now in the chat. And then, yeah, we can go from there. So, Sarah, since you're first on the screen, I'd love it if you wanted to just kick it off, and then maybe we can go in order. But just some prompting questions would be, can you share just a little bit about your experience, maybe an impactful moment? How does our tagline resonate with you? And then if you had one piece of advice for someone going on the program, what would it be?
Yeah, for sure. So hi everyone, my name is Sarah. I participated in the Dehradun and Rural Himalayas program in January 2023. Since then, I've been working with CFHI as an alumni advisor and then programs assistant, and now also alumni advisor coordinator as well. So you'll be hearing more from me, everyone who's doing future programs. Um, and an impactful moment or experience from my time in the program. There was so many, but I think for me personally, the one that sticks out the most is the final week that I was in India. There was a schedule change. We had to be kind of flexible just because of some logistics things, but we ended up having a kind of week-long short internship at a school in Dehradun for disabled children. And that week as a whole, getting to work there and see a different aspect of the healthcare and public health system that we hadn't gotten to see earlier on was super impactful. And we got to interact with so many different people and just like learn so much about accessibility and disability access in Northern India, which was really cool. Um, CFHI's tagline, Let the World Change You, really resonates with me because that was my first ever experience traveling internationally besides going to Canada. I went into it just wanting to learn as much as possible and to kind of soak everything up like a sponge. And I felt like I learned so much from that experience and it really shaped, my future in public health after that. Now I'm getting my master's and I've done a lot more work internationally since then. And I think that my CFHI experience was what really fueled that from the beginning and really did change me and my outlook and my future career in public health. And then one piece of advice would be to kind of go along with that, to be flexible and adaptable to change. Whenever you're doing global public health work or internships or studying abroad, I think there's always a level of flexibility that you have to have because unpredictable things can happen at any moment, and there's so many pieces and logistics going into the program that you're a part of. But I think if you're flexible and ready to just take in everything and go with the flow, you're going to get the most out of your program and you're going to learn and experience so many amazing things. So, yeah, I would just say to go in with an open mind and be ready to just learn and experience and soak in everything.
Thank you so much, Sarah. Beautifully said. And again, for those that maybe didn't catch it, Sarah went to Dehradun, India. So if you have questions for her, save them for the end of the call or put them in the chat, and she'll be here to answer those. I believe Emma's here. Emma, do you want to go next?
Yes. Hello. My name is Emma. I went to the Philippines last spring, so April 2025. And one of the more impactful moments from my experience was we were placed on a rural island that had one kind of clinic, and we spent the majority of our time there. But our last week in country, we were able to shadow some health workers, community health workers, and actually go do outreach in the community. So not just being in the clinic, but going to patients for immunizations and house checks for those who couldn't travel as easily. And it was really a moment for me to see how much the community came together in these rural settings to make sure everyone has access to healthcare. So that was pretty impactful. And what's resonated with me after the program was obviously going into new culture and a new healthcare system. There are going to be a lot of differences from, my own experience here in the United States. And so I kept a very open mind, and I learned a lot of how culture can impact medicine and how it is practiced in different places. So now coming back to the United States, I live in New York City, which has a very diverse patient population. So just trying to always kind of keep that in the back of my mind, that all of these different cultures impact the way people come into medicine and how they want to be treated and what they're comfortable with. So really letting that carry on in what I'm doing now and what I'll be doing in the future. And my one piece of advice would be, when you're comfortable, just say yes. There are going to be so many amazing opportunities, specifically cultural opportunities to try new foods, see new places, maybe try dancing. And just if you feel like you're comfortable within yourself, doing those things can be really fun and immersive. And I would definitely recommend that.
That's a great piece of advice. Thank you so much, Emma. Yeah, I always like to emphasize that whenever you're doing an experience like this, it's you get as much of it out of it as you put into it. So it's we encourage you to go outside of your comfort zone, of course, where you feel, safe in doing so, and you really just absorb and be a sponge of those experiences. All right. Next we have Casey. Casey, I know you're cooking dinner, so if you can unmute, that'd be great. But if not, we can save you for later.
Yeah, no, we're good. Hi, I'm Casey. I did a surgery rotation in Durban, South Africa. That was in February of this year. So I just got back like a month ago, a little less. And I really wanted to do the international rotation because I want to do international relief work one day. And I want to learn, first of all, how medicine is practiced in other countries and how it differs from what I'm used to, and also how to work with limited resources. So the hospital I was at in Durban, Victoria Msenge Hospital, was a government hospital, not very affluent, a lot of limited resources. And I learned so many ways of how to be creative in order to give patients the care that they need and that they deserve. Um, and I will echo that it's important, if you're comfortable, to say yes to things and be flexible. I remember the day I got there, within 5 minutes, I was invited to a Zulu wedding, and like didn't even unpack my stuff, just changed my outfit and left and went with my host family to a Zulu wedding, which was a really great experience. And like very unique. I would not have gotten it if I had just, she said that most students probably would have said, no, I'm tired, I'm going to stay home. But that it was very cool that I like said yes and went. And I was just honored to be invited to be there. And also to remember, I did study abroad in undergrad, so I was a little bit more familiar with it, but remember that you're staying in someone else's house. I've heard some horror stories in my time there of students who went there and just were not respecting the family culturally, or not being considerate. A lot of people have never lived with somebody who's not in their family and who doesn't do things exactly how they do it. So I think that's a huge, very important part of doing any sort of study abroad is a homestay. It really will show you what it's like to live there and not just what it's like at your hotel. It gives you, lifelong friends, that your host family, that if you ever come back to the country, if they ever come to your country, gives you a lot more like cultural insight. And yeah, just remember that you're in somebody else's home, that they're opening up to you. You're not entitled just because you paid money for the homestay. And treat everyone with respect and be open. And maybe they do things differently. And that's okay. Remember, you're not in your own country. There are definitely some cultural things I came across that maybe in the US I would have kind of pushed back on some things, but I just remember that I'm not in my own country. I'm a visitor here, I'm a guest. And so, you know, keep that in mind whenever you're going. But yeah, I learned what I meant to learn when I went there, which was there's a completely different scope of practice between different health professionals in South Africa. And there are a billion different things you can do with a rubber glove that can replace a lot of resources that are missing.
Thank you so much, Casey, and great advice. And thank you. It's always helpful to hear, from your experience in the homestay. Um, just to touch on that a little bit. Our intention is not to put you in a five-star hotel because that would not be a true, accurate depiction of like the normal day in the life of someone in the country you're visiting. So that's why, the homestays are really designed to give you a great taste of the culture and really truly immerse you. And that's if you're staying in a homestay. If not, then we also, put you in a different type of program housing, which might look like a guest house or apartment, depending on which site you're going to. Okay, last but not least, I believe Anna's here. Anna, would you mind going?
Yeah, I'm here. Hi, guys. I'm Anna. I went on the trip to La Paz, Bolivia this past February, so I just got back like a month ago. Um, La Paz was such a cool experience. So during your time there, what you do is you kind of get the experience to rotate at different hospitals or different healthcare settings, which is cool because you get to see so many different lenses of how they do healthcare over there. I just thought it was awesome. I had the best time. One of the, I guess, most impactful moments I was thinking of, um, so again, you get to rotate with a lot of different teams. And so one of the teams I actually rotated with was the milk bank at the women's hospital. And so what they do is they go around the hospital to like postpartum moms that are just, maybe 1, 2 days postpartum, and they'll help, teach the moms how to breastfeed. They'll help with latching. They help with pumping, help teach moms how to pump. It's a really cool experience, but I think the most impactful thing about it was watching the women. So in the rooms, there are like multiple postpartum women in one kind of hospital room. And when you go up and help one mom, you'll see all the other moms. They'll be like chatting, being like, oh, this is how you do this. Oh, like I like it this way. Like, let me hold your baby so you can do this. And it was just such a cool thing to see what a sense of community they have over there. And definitely different than what we have, what I've seen in America and our postpartum hospitals on rounds and things like that. And it was just so awesome to see that. Um, the tagline, let the world change you. I agree. I think a big, like, what that really means to me is like a big reminder to keep an open mind when you jump into settings like these that are so incredibly different. It's just so important to just keep an open mind and almost just like go with the flow. I think a lot of times you're put into situations that's new and things are way different and it can feel a little bit overwhelming. So I think just like keeping an open mind and going with the flow is the best way to get the most out of your experience. Um, the piece of advice would be along a very similar line. I loved what Emma said. She was like, just if you're comfortable, say yes to things. I love that. I think there were so many cool experiences that I got to do, like with my host family, culturally, with the program itself that, I said yes to and I got really awesome experiences out of. So again, if you're comfortable, say yes. And then the last thing would be, or another piece of advice I thought of would be, like if you want, keep a journal during your time there. I think it's cool to have that, have your thoughts, have your experiences, have those things kind of written down. So that later you can look back at it and be like, oh yeah, I remember when I did this and like remember how impactful it was and how you felt during those times. So that would be a piece of advice I would recommend.
Thanks, Anna. I totally agree with the journal component. It like even if you journal once a week or like every few days, it's always so helpful to like look back on it because even now like I can think back to experiences that I've had in recent years, and it's so hard to like actually remember those little details. Like you remember, the way you felt and the people you met and the relationships you built, but it's hard to actually remember the important details sometimes. So yeah, my suggestion would also be to journal as much as you can, and it's even years from now it'll be really cool to like look back on it and you'll remember like little small moments that maybe you didn't realize before, remember before. Casey, thanks for sharing your kitty. How cute. That is a big cat. Adorable. Anyone else is welcome to put their cats or dogs on the camera, just so you know. All right, let's go ahead and move on really quickly. So, I'm just gonna spend a few minutes talking a little bit about like what you should expect from here on out, as you're, preparing. We heard from some alumni today, but I did just want to reiterate to all of you that we do have an alumni advisor program. So there's actually going to be an alumni advisor assigned to you who's done the program before, and they're going to connect with you before you go. As you can see, the alumni are a really great opportunity for mentorship and just support. They're a great resource for like connections and um, recommendations or, just hearing about their on the ground experience. So they will reach out to you usually around 3 weeks before you go. And just so y'all know, Emma, who is here with us today, she is an alumni advisor for the Philippines program. But we have lots of other alumni advisors who you'll have the chance to connect with closer to your start date. And I also like to just call out our amazing global team members. I am one person representing all of them. So, CFHI programs would not be possible if we did not have the amazing medical directors and local coordinators and preceptors on the ground at all of the sites that you travel to. So, just so you have an understanding of like the support you'll have on the ground. Each of the sites will have a medical director who's the person overseeing your health activities, your rotations. You'll also have one or more local coordinators who are helping with more logistics like lodging, transportation, etc. They're also going to be like your on the ground go-to cultural expert. And then you'll also have the preceptors who are usually the people you are getting to actually like rotate with and shadow and interact with in rotations on a day-to-day basis. So what to expect now? I know many of you are already enrolled. If you're not enrolled, then there is like an application process that you'll have to go through. And then if you are enrolled, then the next steps are kind of to continue working on the forms. There's also going to be some training modules on there. I promise that these things are not busy work. They're really designed to help us support you abroad. So some of the forms are going to be like lodging preferences, if you have any dietary restrictions, allergies, if you have any requests for your homestay or your accommodations, that's going to be a form that's available to you. And then there's another one called placement preferences. So if you have any preferences for what you're seeing in your clinical or public health rotations or anything like that, that'll be there. And then with regard to the training, there's a few different courses you'll complete. The one I like to draw your attention to is the one that has the program logistics. It's going to contain a lot of details about what to pack, health and safety, when to book your flight to arrive and depart, and the more logistics side of that. So just so you know, if you have like a bunch of questions right now, that's going to be the best place to look first. And then there's also just some other trainings on global health ethics, cross-cultural adaptability and effectiveness, and self-care and wellness. So those are all things you'll work on before you go. And then once it gets a little closer to your start date, we are going to have an online health and safety orientation that you attend. It's also a great opportunity to meet other people who are going to the same program during the month you're going. And we will also have an on-site orientation after you arrive. So you'll arrive on a Saturday usually. You'll be picked up by the airport from the local team. And then the following day, you'll have an orientation on site. And then lastly, just so you kind of understand what's included with the program, you can expect anywhere from 5 to 6-ish hours a day of more health-focused activities. There should be a weekly meeting or a lecture from the medical director or another designated healthcare professional. If you're going to a program in Latin America, we also will provide you language classes. And then lastly, there's a whole bunch of things that go on in the background of your program just to make sure you are supported with your health and your safety 24/7. And here are just some final, I guess, tips for your pre-departure preparations that are hopefully going to help you set yourself up for success. We talked about this a little bit earlier, but just to reiterate, the program is really designed to push you out of your comfort zone because that's really the best way to grow as an individual. Here are some tips from our Director of Health and Safety is really to start building your cultural agility skills now. So again, there's going to be some helpful training modules in the CFHI application process to work on, but we also encourage you to do as much research about your host country as you can before you go. So maybe read travel blogs, watch videos on YouTube, try and connect with individuals maybe on Facebook or anything like that, just so you can learn as much as you possibly can before you go. And that way you have a better understanding of what to expect. And then lastly, start planning for your health and wellness needs now. There is going to be a health history form on your CFHI application that you fill out. So if you have any special considerations or need any accommodations, you'll share that with us, and our Director of Health and Safety is going to follow up with you to help create a health action plan and, just make sure you're supported on your time abroad. So just a really quick timeline of the next steps. Now you should be working on the application. If you're not enrolled yet, I would suggest getting it submitted as soon as possible. A lot of the programs are already full for the summer, so the sooner we can get you in, the better. And then just in terms of leading up to your start date, we will send you an official welcome package about 60 days before your start date if you haven't received one already. This is going to be inviting you to that health and safety orientation I mentioned, and it's also when the deposit is due. And then 45 days before the start date is when the rest of the application forms and payments and everything are due. And then about 3 weeks before you go is when we'll have the orientation on Zoom. That's also when the alumni advisor is going to reach out to you. And then lastly, about 1 or 2 weeks before you travel, the local team is going to connect with you either via a welcome email or a call. Okay, I actually don't think we have time for the breakout rooms, and there's not too many people here in the audience, so I feel like it would be a better use of our time to just have a little bit of a Q&A session, especially while we have the alumni advisors or the alumni here. So yeah, I'd love to just open it up if anyone has questions about the application process, or if you have a specific question for any of the alumni advisors here or just in general, feel free to unmute or throw that in the chat.
Hi, Anna. I wanted to ask you a question about your Bolivia program because I'm going. What's some like specific advice that you would give to someone going on that program? And also like what was your favorite like kind of excursion that you did?
Oh my gosh, those are good questions. I had such a good time on my trip to Bolivia. I think specifically for the trip to La Paz, um, I think one of the things is like get to know your host family. So I had actually when I went there, there was a pretty big group of students. I think there were like I don't even know, like 15, 16 of us, maybe even more. So I got to chat with a lot of the people and there were lots of people at like different host houses with different host families. And I think that everyone had like really cool individual experiences with their host family, whether it was talking about like the origins of the food that they were having or going to some of like the more local markets, learning about some of the cool traditions that they do. I happened to be there during like Carnival time, so I got to hear from my host family so much about Carnival and like how they celebrate it. And they also have some kind of different traditions and holidays around the same time. So that was really, really cool. So that's something more specific to La Paz, that I would say I would give you advice on. I actually forget your second question. Can you repeat it?
I said, what was your favorite excursion that you did?
Oh my gosh, my favorite excursion. Okay, yeah, I went in my during my time in Bolivia, one of the weekends we took and went to the salt flats. That is one of the like most highly recommended excursions when you're in La Paz. I definitely recommend it. It was so cool. It was the only way I can describe it is it felt like I was on a different planet. Um, like even the pictures that you'll see online if you Google like Bolivia salt flats, like won't do it justice. It's so cool to see in person. We did one of the tours and they took us out on the salt flats and then we got to see like the sunset and it was just absolutely beautiful. So that was my, yeah, definitely highly recommended excursion.
Thank you.
Thanks, Anna. Um, Casey, just we have one question for you in the chat. Sorry, I know you literally just walked away.
No, you're good. I
Um,
was just going to get my drink.
your apple juice. Just kidding.
My apple juice, yeah.
Um, okay, so one question is just I think Fatumata is just looking for any advice as she's going to Durban in June. So any other advice that you have to share that you didn't before?
Yeah, there are not going to be hospital scrubs available for you, so bring your own scrubs. If you have a hospital pair that well, are you a medical student or a pre-med?
I believe she is an undergraduate, from what I know.
Undergrad. Okay. So you're not going to have hospital scrubs, but if you have like any pairs of other like random scrubs, cheap scrubs, bring that. Because yeah, they don't have hospital scrubs for their own residents, let alone for the international students. Um, bring a hand fan. It saved me a billion times over. They don't have air conditioning at home or in the cars or in the hospital. I went in the middle of the summer for them, so hopefully it'll be a little bit cooler for you. But my hand phone saved me like
Mhm.
just a little, something. And yeah, it was a really great experience. I feel like there was one more thing. Oh yeah, insect repellent, like picaridin lotion all day, every day. I've even when you're at home or when you're in bed, it's very nice to have that and not have to worry. I think
Mhm.
those are my big things as far as like specific advice.
Yeah, those are great. And honestly, they apply to a lot of the sites you go to. But it reminds me, a great thing to do is definitely check out the weather where you're going beforehand. Um, Durban is a usually more mild climate in the summer, or sorry, I say summer, but it's not their summer, it's our summer. So in June and July, it's going to be probably a little bit colder than their summer. So just check out the weather and, figure out what it's going to be and what you're comfortable with. If it is going to be warm, definitely plan on bringing cooler clothing, bug repellent as well. Those are all really great advice for probably, I think I would say like all of our program sites. And also a lot of sites you do need to bring your own scrubs. So there is going to be a recommended packing list in your CFHI training. If it does require scrubs for clinical retire, then yes, you do need to provide your own scrubs and usually a white lab coat as well.
I will add too, I would bring every pair of underwear you own because the host family will do your laundry, but culturally, most places they are not comfortable doing your under laundry. And so that's me washing it in the sink type. I wish I had brought every pair I own just because that would have been nice.
Thanks, Casey. That's good advice.
Yeah.
Awesome. All right. Any other questions for our
Um,
alumni?
oh, sorry. I had two questions actually for Sarah about the Dehradun program. First, I was wondering if there were any, if like given what the schedule allows, what she suggests or what Sarah suggests for excursions like in the city. I know that there's like for this program you go to multiple different places, so any suggestions there? And then also relating back to the scrubs and like the white lab coat, more specifically, is there since we're providing those ourselves, is there like specifics outside of what is like put in the packing list, like where brands we should be purchasing from, colors, such like stuff like that?
Yeah, so these are two very great questions. Thank you so much for asking. So for the first one, for excursions, and kind of fun things to do, there are so many things and so many recommendations I have, and a lot of opportunities as well. One thing that I really enjoyed was, we were in continuous contact with Hema, who is the overall India coordinator. She coordinates the Delhi and Dehradun programs, and then our local coordinator, Mayank, as well. We were in continuous contact with them all of the time, and a lot of times Hema would message us being like, "Hey, do you guys want to do any traveling this weekend?" And we were kind of wanting to experience as much as we could. So we would always be like, yeah, we would love to. And then she would give so many great suggestions and help us with like if we needed to take a train somewhere, like help us book the ticket and help figure out drivers. And she even we'd like plan a sample itinerary for us. And it was like the sweetest thing ever that we would get to do on the weekends. So I think some of my top suggestions. So in Dehradun, there's a big marketplace that is really great. You can find like anything there. It's a great place to get like local crafts and souvenirs, like more local goods, which I think is really amazing. There's a lot of great cafes you can go to, and your local coordinators will know a lot more about like some of their favorite spots as well. Another thing I recommend is just talking to the coordinators once you're there about like their recommendations. My uncle was really excited to, well, there's one day, one weekend, he took us to all of his favorite places, like his favorite place to eat, his favorite place to get dessert, his favorite place to shop. Like, and it was like really cool because like they were getting to share some of their favorites with us as well. And then outside of Dehradun, I think um, going to Agra to see the Taj Mahal is like a very popular one that a lot of people do. And it's beautiful and it's huge. Also, I recommend going to Jaipur. There's so much you can do there. We ended up doing a weekend trip there and staying in a hotel there. It was really good price and really like awesome amenities, and there's so much to do in Jaipur. The architecture is beautiful. There's a lot of different, it's in a different state in India, so it's different cuisine, different fabrics and textiles. So I think it's a really great opportunity to see some different things. Rishikesh is a really fun day trip. You can go to a bunch of different things there, and it's right on the river, so it's really pretty. And then once you're in Mussoorie for the week, which is up in the Himalayan foothills, it has like the most beautiful places to hike, and the locals are all very sweet. There's amazing cafes there as well, but I really recommend hiking up there if you're able, because it's like one of the most beautiful things you'll ever see. You're in the Himalayas. So I don't know like what could be more beautiful than that. Um, yeah, and then the second question on scrubs. So this definitely differs program by program because for Dehradun, we it was kind of optional for us to like we brought scrubs, but we ended up not needing them. The dress code for a lot of things were just long pants and like a nicer shirt and closed-toed shoes. I wore my scrubs sometimes. There's no requirement for brands, colors, anything. I was an undergrad public health student at the time. We had one medical student on our trip as well. She brought her white coat and she did wear it sometimes, but she wasn't required to. So it was a little more informal with the dress code there, just as long as you're covered up and like, wearing respectful clothing and just like not wearing like sandals or anything in the clinics. There's a lot more flexibility with that. So I think kind of you can kind of assess what you want to bring and whatever that is, that should be fine, but don't feel like you have to go buy certain brands or colors or anything.
Those are amazing responses. Thank you so much.
Mhm. Yeah, thank you, Sarah. And all of this to say is there is information in the pre-departure training for everyone, but take it a little bit with a grain of salt because things change. And it's not always that easiest to update information right away if it changes. So you will connect with the local team the week before you go. So if you have those like last minute questions, they're going to be the best place for that as well. And if there are sites that have very strict attire, like clinical attire, we'll make sure to share that with you beforehand. So no worries. I would say, follow the packing list to the best of your ability. Chat with your alumni advisor before you go. And if you have any specific questions, chat with the local team before you go as well. All right. Thanks, Casey, for putting your information in the chat. There's one more question I see for Anna about communicating with your homestay family in Spanish. So yeah, if you could actually just give your overall take on the language experience, maybe let us know what your language skills were going into the program, how it was communicating with your family, how was it shadowing, and yeah, any advice that you have there.
Yeah, definitely. So I took Spanish like all of high school, and then I think I took like a class or two in college, and then I actually studied abroad in Madrid for a semester, so I learned a little bit of Spanish there. But I was mostly also like really like an intermediate conversational speaker, definitely not fluent in any means. And I was definitely able to get by with my host family. My host mom actually specifically only spoke Spanish, like she spoke almost no English. But it was honestly not even really a problem, and I don't have that great of Spanish, but I was also living with another girl who spoke Spanish a little bit better than me, so that was really nice to have as well. But that was just dumb luck. Um, but yeah, it definitely having like a basic conversational understanding when going in is probably going to be enough, and it's going to be great for you because honestly, a lot of times in the hospitals too, the services you're working on, like, yeah, there are medical terms, but it is very conversational. Like not all of the things you're going to talk about are necessarily going to be like strict, hard medical terms. And then also in my opinion, the Spanish classes in La Paz were excellent. They were like the teachers that you have are amazing. They were so good at starting from like getting a feel for where you are and then going from there. Like my very first Spanish class, I sat down and we literally just went through like a bunch of medical words, like basic ones that you would use. Like, okay, let's talk about pain or feeling or sickness, or how do you ask a patient this? What do you say when you introduce yourself in the room? Things like that. So I don't know. I think before your trip, if you wanted to look up some of the like more medical Spanish, that'd be good. Also, practicing conversational Spanish though is gonna be helpful, especially with the host family. So hopefully that was a good answer for you.
Thanks, Anna. Yeah, the more you can practice before you go, the better. But you are really going to be thrown into the language, so just be ready for that and expect a language barrier a little bit. But it's again designed to really push you out of your comfort zone so that you can learn more quickly and immerse yourself. Okay, I don't see another question, but I have one since we have Emma here. I have one question that maybe could be helpful for anyone going to the Philippines. Could you just share a little bit about like island living in the Philippines? What island were you on, and like what can people who are going to the Philippines maybe expect on the remote island?
So I was on Lubang, and all of the focus of the Philippines is rural healthcare. So these islands are very rural, and my island was large in terms where it was geographically large, but there's still only small kind of pockets of population around the islands. So access to healthcare is very limited because the Philippines is a country made up of islands. I think it's over 2,000 islands. So there's one public hospital in the entire country of the Philippines. So healthcare really has to be focused on the island. So living there is very much communal. It's very much the people who work there are the people who are from there. And these people want to get back to the communities. Everyone, there's no really healthcare privacy. Like everyone kind of knows what's going on. So if someone doesn't show up for their appointment or needs a medication, like their neighbor will help them get it, or they will all kind of contribute and pitch in to really make it more accessible for each other. And in terms of like how we actually lived, we were lucky to have like electricity and Wi-Fi at my home state, but that's usually not a guarantee usually there's a ton of blackouts constantly, so usually you don't even have electricity. Um, the clinics always did because they had generators, but yeah, so it was very kind of minimal, scaled back living, no running water, you're taking bucket showers. But it was a really nice way to kind of take a step back from kind of like our modern living and really immerse simply in the culture and the medicine there.
Thank you so much, Emma. So great to hear your perspective. We're just about at time. Casey had one more recommendation in the chat about seeing a travel clinic before you go. That is a recommendation for all CFHI programs that we recommend you to see either a travel clinic or your primary care provider before you go. They can basically just give you the best like advice based on your specific needs and on maybe medications or vaccinations or anything like that. So yeah, we definitely recommend that. But yeah, I don't see any other questions. So um, oh yeah, thanks, Anna. Costco has travel clinics. Oh, that's great to know. Also, your universities as well. If you're enrolled in a university, usually they have travel clinics on site too. That can be a little bit more accessible. Um, but that's great. So I think we can close it up. Let me just go to the last slide here. So if you have questions or if you want to check out our social media to see other alumni experiences, feel free to look those up. Otherwise, questions can go to students@cfhi.org. We're really looking forward to welcome you all to a CFHI program. Thank you so much to the alumni for being here. It's always so great to connect with you guys again and hear about your experiences. And it's really just, immeasurable the amount of help and support it provides to students who are considering the program and want to hear directly from you guys. So we appreciate you being here. And then to all the students who are traveling, feel free to continue through the application steps. But if any questions do come up, we'd love to connect with you. So reach out and we'll get those answered. Otherwise, we'll be in touch with next steps, orientation, and all that good stuff. So thank you all again for being here. It was great to have you.